Hello and welcome to Sybil Wilkes Live. Yossi Media is proud to present Check-In and Check-Up for Your Health, a discussion about Minority Health Month and preventative steps for better health in partnership with the American Heart Association. April is National Minority Health Month. It's a time of year dedicated to raising awareness around the health disparities and illnesses that disproportionately impact individuals of racial and ethnic minority groups. As African Americans have suffered most from the pandemic, it is even more vital to focus on improving health outcomes. In tonight's Check-In and Check-Up show, we'll discuss illnesses African Americans suffer from at a higher rate, including high blood pressure and hypertension, and what we can do to keep ourselves healthy. Tonight's panel includes cardiovascular disease epidemiologist Dr. Yvonne Commodore-Mensah, celebrity and healthy lifestyle champion Chef Daniel Thomas, and actor and comedian Guy Torry. Before we hear from Sybil, listen to this important message from the esteemed senator from the great state of Minnesota, Senator Amy Klobuchar.
Thank you, Sybil, for inviting me to share a few words with you today. And thank you for all the work you do through your check-in and check-up for your health shows to inform and educate your audience on steps that they can take to live healthy lives, their best lives. It's so important for families and friends to have these conversations, to encourage each other to get screened and get care. And that's especially essential during Minority Health Month. As you know and I know, healthcare disparities in Black communities across the country have devastating consequences. We saw it during the pandemic. It was a big, fat magnifying glass on all the disparities in this country. Heart disease is no exception. In a number of states, African American adults are twice as likely to die from heart attacks than white adults. And across the U.S., almost half of Black women over the age of 20 suffer from heart disease. And these aren't just statistics. These are moms, dads, sons, daughters. This disparity is unacceptable. That's why I'm working to pass bipartisan legislation called the Preventative Care Awareness Act to promote screenings for heart disease and other illnesses and to create a public health task force to encourage preventative care and eliminate disparities in these services. This legislation will go a long way toward helping make sure more people are able to take advantage of early detection and treatment. I'm committed to making sure that every American living with heart disease can access the affordable quality health care they need and deserve. And we know that these disparities aren't limited to heart disease alone. Even illnesses classified as rare diseases have a disproportionate impact on Black Americans. Take sickle cell disease, for example, which is often accompanied by heart, kidney, and lung disease. Over 80% of kids born with sickle cell disease or the sickle cell trait are African American. And these numbers have a real human impact. I think of Ray Belalark, the founder and CEO of the Sickle Cell Foundation of Minnesota. Her son, Ray's son, was diagnosed with sickle cell disease at 2 weeks old. Like many sickle cell patients, he's lived through recurring episodes of extreme pain, including an episode so severe that he had to relearn how to walk. And unfortunately, stories like his are all too common across our country. As co-chair of the Congressional Rare Disease Caucus, I believe we can do so much more to make life better for sickle cell patients. That's why I've been working on legislation to make sure rare disease patients, including those with sickle cell, are more involved in the drug development process. And I'm also committed to getting more federal dollars for sickle cell research, screening, and care. It's long been underfunded. The investment we make now lay the groundwork for the cures of tomorrow. Thank you so much for inviting me to take part in this critical conversation. I look forward to talking about how we can work together to address the racial health disparities in our country and improve healthcare access for Black Americans. Sybil, you're the best. Thank you for shedding light on this. You're going to save lives. Back to you.
Thank you, Senator Amy Klobuchar, as our friend Stephanie said, from the great state of Minnesota. Thank you so much for your involvement and for your leadership in this, and especially on the political level, in the federal level in Washington, D.C. Hello, and welcome to Check In and Check Up for Your Health in partnership with the American Heart Association. We observe April as National Minority Health Month, a time to raise awareness about health disparities that continue to affect people from racial and ethnic minority groups. Hello, and encourage action through health education, early detection, and control of disease complications. I'd like to welcome and thank him for coming on today, our comedian, actor, creator, and executive producer of Fat Tuesdays, still available to be seen on Amazon Prime, and my friend, Guy Torry. Welcome, Guy.
What's happening, Sib?
How you doing?
I'm good. I'm ready for this talk today. It's
no,
important.
Really. How you doing? How are you, Guy Torry?
I'm okay. No, I'm okay. It's been a roller coaster. I've had a lot of ups and downs the last week, man, and I'm glad we're having this talk today because I'm explaining this roller coaster ride I've been on.
Okay, so let's talk about that as we are observing National Minority Health Month, and of course we are talking mostly today about our physical health, but certainly our mental health. We have discussions about that as well. What's going on with you?
You know what? I'm on this roller coaster ride. The highs of the Fat Tuesday documentary, doing very, very well, being well received. Everywhere I go, people are talking about it. They love it, awesome. and it's just a great joy. Unfortunately, the lows. I lost a friend last night.
Oh my gosh, Guy.
And health is very important. He's a very good friend of mine who helped me with Fat Tuesdays back in the day. Oh. Who, if he did, taking care of his health a little bit better, he would still be with us. So this talk is very important today for me, and just happy, just still touring, and pitching new exciting projects under the Fat Tuesday brand. That's awesome. We're gonna call it Obese Tuesdays in a minute. Because the brand is expanding so big and so used. I can't wait for the exciting tentacles that are coming out under this brand.
Well, I can't wait for you to share with us what's next in your life. And I am so glad that you're here to talk about National Minority Health Month, because this is something that affects all of us. Yes. And especially you as a Black man in this country. You have your challenges, and yet you are working to stay on top of it. As you have demonstrated, especially during the pandemic.
Yeah, especially today. I think the gods were in a line because I left my other AirPods in an Uber this morning, and I would start tracking it. And I walked about 7 miles today trying to find the person who got in the Uber after me, who had my AirPods.
Wow!
And so I got my steps in today. I was happy today because I walked, and I think they knew I was coming because every time I get to the spot where my AirPods were, they jet to another spot. So I don't know if that was meant to be or what, but. Yes, I got my steps in today for sure.
And Guy, we're going to have a chef on today, but Chef Daniel Thomas. But you are a bit of a chef and a man who really, with a couple of exceptions, you do take good care of yourself.
I do. You know what? It's good. I'm on a fast right now. I'm fasting from some of my vices, which is sweets, meat. Adult beverages and cigars. So I just took a 30-minute break to pause and get my body back together. Get 30, right, lose about 10 pounds.
30 day or 30 minute?
30 days.
Okay.
30 days. 30 days.
Okay, cool.
Just to clean my system out. And it's been working. I feel good. I'm sleeping better. And I'm taking care of that heart.
And also you come from a family in which you seem to be a caregiver for your family and keeping up with their health as well.
Yeah, encouraging mom. In my act, I talk about Black men not going to the doctor.
Yes, you do.
I got a lot of foolishness in my act, but I drop a little gem in there too. And you'd be surprised how many men who are my age and older who haven't had a prostate exam yet, who haven't had a colonoscopy yet. They should have about 10 prostate exams by the time they're my age, at least 10. Or a colonoscopy, because I go and I ask people and I'm like, wow, Black men just won't go. I think it's our ego or whatever, because a lot of Black men have health insurance. I know a lot of brothers who got health insurance. They just don't go, and I think they're scared of what they may find out. But to prevent what's going to happen is very important. That's why I'm glad, you were talking about this today.
Yeah, well, we are so glad that you're here, and you're a fine example of a man who has taken charge of his health, as you say, this month, as you are working to just clear out your system and what have you, and giving up those cigars and adult beverages. So let's take a breath here and also remind people who are just joining us, you are joining our What You Need to Know segment. For those who are just joining, this is Check In and Check Up for Your Health in partnership with the American Heart Association as we observe National Minority Health Month. And so let us welcome our Dr. Yvonne Commodore-Mensah of the American Heart Association National Hypertension Control Initiative and the Oversight Committee member. Dr. Yvonne, I don't know if we have enough time to go through your entire resume, but I do want people to know how vitally important your work is and what you have done and what you are continuing to do. An assistant professor at the Johns Hopkins School of Nursing and the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. Also faculty at the Johns Hopkins Center for Health Equity, a fellow and board member of the Preventive Cardiovascular Nurses Association, as a nurse scientist and cardiovascular disease epidemiologist, a program of research that seeks to reduce disparities in cardiovascular health among African descent populations locally and globally. And we're talking sub-Saharan Africa. That's just Guy, when I tell you that's just a small part of her resume.
I know, I've seen it.
But without going any further into that, Doctor, and I want, because as I said, I want people to recognize what a strong and powerful woman you are in this area. Let's start out talking. First of all, welcome, Doctor. We appreciate you joining us today.
Thank you so much.
And
he's only 12 too, which is amazing.
I know, and that's even more amazing, isn't it? Talk about your child prodigies. Let's talk about National Minority Health Month and what that means to you.
First of all, thank you, Sybil, so much for the opportunity to be here. And Guy, my condolences. I'm so sorry that you lost your friend. My prayers go out to you and their family. And I'm so glad that we're talking about Minority Health Month. And I think you've alluded to this because we know that in the US, racial and ethnic minorities, and especially Black people, have a shorter lifespan than white people for many reasons. And one of the leading causes of death in Black people is heart disease. And that's something that I'm particularly passionate about. How we might reduce the risk of heart disease and promote heart health in Black people. For instance, we know that Black people are more likely to have hypertension or high blood pressure. It's a condition that affects almost 58% of Black people. Black men, Black women are more likely to have hypertension. And what strikes me is that a lot of these risk factors for heart disease, including hypertension, are preventable. Guy, you mentioned this earlier, prevention is key. We're talking about minority health because we can prevent heart disease and other conditions in Black people and promote a longer lifespan. And so I'm so glad that we've set aside a month to acknowledge that we need to pay greater attention to the health of racial and ethnic minorities in the US.
And Doctor, when you talk about how it affects Black men and Black women, also at an earlier age, does it not?
Absolutely, absolutely. So at least 10 years earlier. So we know that in Black men and Black women, hypertension as a risk factor for heart disease occurs at least 10 years earlier. And I actually had this experience about 2 weeks ago where I met a 31-year-old African-American woman who we checked her blood pressure, was part of a community screening at a church. I went with my team and we were checking people's blood pressures and telling them about the importance of heart health. And her blood pressure was 160/100. And so for those of you who don't know what those numbers mean, a normal blood pressure has to be less than 120/80. And her numbers were 160/100. So those numbers were really high. And so after talking to her, we learned that she had a family history of heart disease. Her
Mm.
dad had heart disease. Her mother also had heart disease. And so for a 31-year-old to have a blood pressure that high, it's very concerning and would place her at a higher risk for heart disease. But there's something that can be done about it. And I know, Sybil, we're going to spend a lot of time talking about how we can prevent hypertension and heart disease.
So, just as we are talking about this and your passion for this, how did your profession develop as a result of caring about and looking into and taking control of the information regarding disparities in our healthcare for Black folks and other people of color?
So this issue is personal for me. My father has hypertension, he has
Mm-hmm.
high cholesterol, he has diabetes. So these risk factors that we're talking about, I bought him a home blood pressure monitoring
Mm-hmm.
device to check his blood pressure. So it's personal. But beyond that, I have become aware after living in the US for about 15 years. So full disclosure, I was born in Ghana. I came here as a college student, and over again, I would hear that Black people are more likely to have high blood pressure, kidney disease, diabetes, you name it, right?
Mm-hmm.
But then I got more interested in how we can prevent these conditions and work with people in the community. For many years, we've expected people to travel to see the doctor and actually go in person. And a lot of people are uncomfortable with that model, right? A lot of reasons why people don't show up to their visits: transportation, childcare. So I'm particularly interested in how we might work together with community-based organizations to
Mm-hmm.
make care more convenient. So meeting people where they are. And so where do we find our Black family members and friends? In churches
Mm-hmm.
and other community-based settings. So we need to meet them where they are. And that's why I've committed my program of research to working with people in the community and faith-based organizations and community health centers, right, to improve the management of these conditions.
So, Doctor, we obviously we're limited in our time, but I want you to talk to Guy and me as your girlfriend and your guy friend here, your guy friend, get it? And
Good one.
talk about some of the things that we can do to prevent the blood pressure situation and extended heart disease. A lot of the way that you talk to your dad.
Can I step in real quick? She
Sure.
said something that was interesting about meet people where they are. I'm a fan of the show New Amsterdam. Good friend of mine, Jocko Sims, plays Dr. Reynolds on that show.
Mm-hmm.
But they did an episode where they were checking blood pressure at a barber shop.
Yep.
The doctors moved it because Black men gather and talk sports and talk women and other
And
stuff
other
at
ish,
barbershop.
yes.
Yeah, right, at barbershop. So I thought it was interesting that they set up, at the barbershop checking men's blood pressure and things
And
like that,
that's
which I
becoming
thought was.
more common, isn't it, Doctor?
It absolutely is. There was actually a research study, it's often called a barbershop study, that has shown that when clinicians, pharmacists especially, partner with barbers to check Black men's blood pressure, it helps to improve blood pressure control. And so, Guy, that's a perfect example of meeting people where they are, because we know that people may not show up for their doctor's appointments, but they will not miss an appointment to get a haircut. So how do we make it more convenient for them to have their blood pressure checked? And beyond just checking their blood pressure, getting treatment. So if someone's treatment needs to be adjusted, if they need to take more medicine, if they need to be prescribed medicine, how do we get them the right care at the right time and in the right context? So that's an excellent example of community-based interventions or strategies to improve heart health.
Well, maybe not a sports bar may not be the right place to do that, especially with the Lakers, the season my Lakers had, because my blood pressure would have been really high. We would check it at the sports bar watching the Lakers this season.
And on the other side, his football team won the championship. So, but what can we do in terms of tips to help people as we're going through this?
This is my favorite part, right? I've talked about the numbers and why we care about hypertension and heart health. So the American Heart Association has this concept of Life Simple 7. So it's a good way to remember 7, right? For
Mm-hmm.
every day of the week, Life Simple 7. So there are 7 steps that you can take to improve your heart health. So first
Taking notes.
is, you're taking notes. I love that, Guy.
Yes.
So
Okay, you
first
know
is,
what? I should say
yeah,
our time is short, so we're going to take just a breather here, and we're going to bring on our guest, our next guest. But we're going to continue. I promise. We're going to get you to give those 7 simple steps,
Yeah.
and then we will continue our conversation. Okay. All
that's
right.
great.
So here's where we ask what's really going on, ladies and gentlemen. This is a segment of It's Sybil, if you watch our show with any regularity. And this is Check In and Check Up for Your Health in partnership with the American Heart Association. And thanks for joining us, Dr. Yvonne Commodore-Mensah, as well as Guy Torry, as we continue our conversation about National Minority Health Month. Let us also bring in our wonderful chef, Chef Daniel Thomas.
Hey, what's going on?
Hey, Chef, you are, for folks who don't know, but I'm sure I'm not telling a lot of people anything that they don't know. Chef Daniel Thomas is the celebrity chef. He's a healthy lifestyle champion, an author of cookbooks, and a philanthropist. Also a graduate of the world's premier culinary college, the Culinary Institute of America, with a degree and a focus on nutrition and restaurant law. And also, he is known for his training in biology, anatomy, physiology, and psychology, and a native of the great DC, Washington, DC. Chef Daniel Thomas, thank you so much for joining us.
I just want to thank all my family and friends who supported me in my endeavors today.
So, Chef,
hold on, I gotta do this. I always want to do this. Sybil Wilkes.
Thank you, Chef. It's so good to see you again, and I really appreciate you joining us. Before we brought you on, Dr. Yvonne Commodore-Mensah was talking about the 7 simple steps. So we're going to talk about that, and then we're going to talk about diet as well as your recommendations for a healthy lifestyle. Okay, Dr. Yvonne, I'm sorry I interrupted you, but time was not our friend there.
Oh, no problem. And actually, one of the 7 steps we're going to talk about is eating better. So Chef Daniel Thomas is going to tell us all about that. So the American Heart Association has what we call the Life Simple 7. So one is controlling your blood pressure. So I already mentioned that it's one of the major risk factors for heart disease, for stroke, for kidney disease. So if you have hypertension or high blood pressure, please, one, take your medications if they're prescribed and change your lifestyle. And we'll talk about the lifestyle changes that will help to control your blood pressure. 2 is to manage your cholesterol. So if you have high cholesterol and you're prescribed medications, please take them as prescribed. There are also dietary approaches. There are things you can do in terms of changing your diet to improve your cholesterol, right? The 3rd is managing your blood sugar. So there are things you can do in terms of your diet to improve your blood sugar if you are diagnosed with diabetes or even prevent diabetes in the first place. And then in terms of lifestyle and behavior change, I won't spend too much time talking about eating better because we have an expert here, but there are things you can do in terms of your diet to improve your heart health. So I want people to remember that food can be medicine, right? So when we think about nutrition, there are things we can do to improve our diet to improve heart health. So in terms of eating a diet that is high in fruits and vegetables, right? A diet that is low in sodium, that is especially important for Black people because we are more sensitive to sodium, right? And so consuming a diet that is very high in sodium increases your chances of developing hypertension, right? And cardiovascular disease in the long run. And so exercise or physical activity, when we think physical activity, I think we shouldn't only think about going to the gym. There are many ways we can move more to improve heart health. So exercise is also medicine, right? Food is medicine, exercise is medicine. And if you smoke, quitting smoking is one of the easiest things you can do to improve your heart health, right? Smoking is a risk factor for heart disease. So trying to get help, right, to kick that habit and improve your heart health. And lastly, and I think Guy alluded to this earlier, obesity is also a risk factor for heart disease, obesity is a risk factor for high blood pressure. So essentially, the more of you there is, the harder your heart has to work, right? So even losing 5 pounds can bring your blood pressure down by as much as 5 points, right? So for every pound you lose, also think about the effect that has on your blood pressure and lowering or reducing the strain on your heart, your body, your joints, your knees, right? So there are many benefits of maintaining a healthy weight. So those are the what we call the Life Simple 7, and I hope all of you remember this.
Let me just, Chef, just take a look at our friend Guy, because I was looking at his facial expressions. How you doing on the Simple 7, Guy?
I'm doing pretty good. I wanted to ask the doctor, what's a low number when you're looking at sodium? Like when you look at a package and you see how much sodium is in that thing you're about to get.
And that's
what's
serving.
That serving. What's that low number that we should be looking for?
The current recommendation is that we consume a diet that has no more than 2,000 milligrams of sodium a day. That's a day, not one serving. And sometimes you can buy a canned vegetable and you realize there's as much as 1,000 milligrams of sodium in there.
That's half our day right there.
That's half your day right there. If you buy a sandwich, and I won't name the fast food company, and you'll be shocked to realize that some of these sandwiches have as much as 1,000 milligrams of sodium in just that one sandwich, right? So that's what's recommended. But the average American consumes as much as about 5,000 milligrams on average a day. But one thing we need to remember is there are things we can do as a society to allow people to eat healthier diets, right? So what if fast food companies decided that they would lower the sodium content in their meals, right? So on the population level, we will see that benefit. So it's not just leaving the choice to people too, right? Sometimes it's easier when the default is a healthier option.
Got it. All right, Chef Daniel Thomas, thank you for your patience and as we get our advice from the doctor. Now we turn to you, our food specialist and advisor. And like Dr. Commodore-Mensah has said, we need to eat better. We need to exercise. But we know these things, but carrying them out, especially in terms of our feeding ourselves each day. How do you, or what do you do to encourage and inform and empower us each day to eat better, to eat properly?
Praise the Lord. Thank you so much, Sybil, for that. And first, Guy, let me just tell you real quick. I don't care what you said. You said 30-minute
fast.
Yeah, I meant 30. I meant 30 days.
I meant
30 days.
But I like the 30 days. It's 30 minutes at a time.
I meant 30 days. That's my fault. I meant 30 days.
No, I'm just giving you a hard time, man. Obviously, Dr. Yvonne, awesome job. Guy, huge fan. So for me, it's most of my clients. Look, we're family here. We were talking about minorities, and I'm not even going to focus on minorities right now because I think that so many cultures and races get bought into minorities that are necessarily not minority. So I'm going to focus on kinfolk, on Black people. And I'm going to tell you, when it comes to it, the reason why I think it's a great job to listen to everything that Dr. Mensah said was because, one, I kind of go with like a three-part aspect. First is facts. So understanding when you see a doctor only about 2 to 3, 4 times, depending on what you have a year. You're going to see me and all the other chefs the other 361, 62 days for the year. So here's just a couple of aspects of how to eat healthy. One, let's go to fast food. Let's just call it what it is. So I want you all and all the viewers who are looking, I want you to take a moment and I want you to actually go to the website of whatever location you want to go to, whether it's that first one we were thinking of, or that second or third one they were thinking of, because I see how she did it. Come on, we pivoted. Thank you,
love
Jesus,
that.
for the pivot. Thank you. And so I want you to go in and I want to look up the burger or the chicken tenders or whatever it is, and I want you to understand that there are certain, if not all of them, but certain ones where you have no clue. It may say a bun, burger, or chicken. It may say sesame seed or brioche or whatever it is. And if you really look at it, the bread that we can make for each other at home is about 4 ingredients. The bread that they have to make so it can last 6 months to a year has about 50 to 60 items, preservatives, citric acid, monophosphate items. You know what? Actually, most of the matter of fact, who eats fried food in here? Praise them. Right. Look, y'all. I feel like y'all, Lord, Jesus, like some liars. so I know, right? That was like I thought it was gonna be a church finger. So when you look at it, so fried food. When you cook fried food, what happens to your oil after like the first 20, 30 minutes? You're frying food.
It hardens up and
but the color, what happened?
Oh, it turns brown, right?
It turns brown, it turns dark. And after you use it for like a couple of hours, it's dark. It's super dark. It's especially if you have the fire too high, which most Black people have the fire too high because we be trying to cook the brakes off of everything. So when you look at that, but if you look at it, when you went to the fast food location, when was the last time you saw them change that oil, and how come that oil stays the same the whole time?
I think some places have never changed it.
Because at the end of the day, they have anti-foaming agents, which are the same aspects in there that you will see in your home cleaning equipment and sprays.
Okay.
I'm just giving you, look, I'm just showing you love because you asked, but to understand this. So I say F. And the first one is saturated fats. You want to be careful of saturated fats, which is pretty much processed foods. When you're going to the grocery store, you want to make sure that you eat on the perimeter of the grocery store and not the inside.
I remember you telling me that years ago. Yes, stay on the outside.
So because what happens is everything on the inside, like first of all, there is not an avocado that I know of that does not turn black the moment that you open it up after 5 minutes. So for some reason, avocado salsa now is in the center aisle. That makes no sense to me. That means that they're preserving it, utilizing things. That's bad for your health, your heart, your arteries, because they have to preserve it. So all that stuff that you're eating is terrible for you. The other reason we were talking about sodium intake. So the first one is F, fats. So watch out for your saturated fats. There are good fats, bad fats. Most processed foods, fast foods are terrible fats. I actually stopped eating fast food for 2 months. And when I stopped eating fast food for 2 months, I actually have not eaten fast food in about 2 years now.
Wow.
Because I said, oh my gosh, it's so salty. And what happens, we eat so much of it. I mean, most Black people, let's call it what it is, we season our food before we eat it. It just happens. It's just, God, don't do it, Guy. I've seen you in a restaurant. I'm just playing. I've never seen you in a restaurant.
So Chef, we're running short on time. What's the second F?
So no. So the first one is fat. The next one is fiber. You want to have a higher fiber diet during that time. And also the S is the sodium that we talked about, and that also is making sure that you're not adding so much salt. So just to give you guys some quick numbers because of the sodium, about 5,200 something is about a teaspoon of salt.
Wow.
So just to kind of let you guys know in terms of milligrams. So when you're talking about cutting that in half, what she said about 2,000, that's like a half a teaspoon of salt for the day. I actually am more of a fan of kosher salt and sea salt because you can use less. You should only utilize just a pinch of iodized salt a week. Don't take it out of your diet completely because you need some iodine in your system. And I love that I got the head shake this way from the doctor. So hey, we heading in the right direction because everybody's like, what did she say? What was she saying?
So the iodine, we need that.
So you need a little bit of that once or twice a week in your system. And that's just, and also reduce the amount of sugar. Get your checks. I go to the doctor often if I feel something, but just be careful. Also, don't eat as much. Your eyes speak. The last thing I would say when it comes to food, don't eat so much. Everybody's talking about prep, meal prep. If you eat lasagna, the last thing I would say is lasagna because that has cheese, that has everything that you need to clog your arteries. Lasagna, what happens when you come home and you have a pan full of lasagna in your refrigerator and you had a long day at work, you're tired, you don't feel like it. Come on. I know you feeling me. What happens when you when you take that pan out of the refrigerator, what do? You sit there and come on, thank you, Jesus. Sybil, everybody has done it. You take the largest portion that you can see, and you don't understand
take that spoon off the wall. You
take that Jesus spatula and you sit there and you dig, and then when you're done with that, you scrape the sides. You want to get that cheese that's at the bottom. You got to make sure. Yes, come on, you get to the edges, and then you don't realize that if you were to start to chop some of that down, it spreads out. So I know we're closing, but if you prepackage portions in the refrigerator before you put, after it's cooked, let it cool a little bit, prepackage it in a container. So the moment that you come out and when you get home, your family, your kids, your husband, spouses, partner, everybody can eat. Go ahead, Guy.
I just want to say something real quick, because someone like me,
Guy, hang on one second, because we're going to take just a quick moment. And we're going to remind people that you are joining us. I hope that you will, if you're just joining us, I hope you'll go back and watch all of this, because you've missed a lot of great stuff. This is Check In and Check Up for Your Health in partnership with our friends at the American Heart Association. And thank you for joining our discussion about National Minority Health Month. And our guests are my friend and comedian, Guy Torry, who is doing the darn thing everywhere, as well as Dr. Yvonne Commodore-Mensah, who is a wonderful physician, a PhD, and doing great things in minority health, and our friend Chef Daniel Thomas, who his personality is as flavorful as his food is. So thank you so much. So Guy, go ahead with your question.
Well, someone like me who's an entertainer, a comedian who travels a lot, and there's a lot of business travelers out there too. It's hard to eat sometimes healthy, especially being a comedian, because we eat either comedy club food, which is not healthy, or eating fast food because it's late, nothing's open. You got to eat. And it's just tough. What can you tell people who travel a lot?
Short of hiring you to be with us.
I know, right? So I've had to travel with so many different comedians and presidents and Congress and senators. And what I do when I travel with celebrities is, one, you have to understand your writer list, because you can control some of that writer list when you reach out to them. And for those who all wonder what a writer list is, it's just pretty much a list that celebrities have that they say, hey, I want this and this in the room before I get there. And it's just those. Minimize on the
separate the red jelly beans from the green jelly beans.
right. Because the Lord knows I'm not. I'm like, what? I'm not separating. No, but but in short is ask them. Either wait until you get off stage and go to a restaurant, or making sure that they have. Tell them ahead of time, because the chefs, if you let them know ahead of time of certain things that you want, they can make it happen. Especially looking at the menu. So to be honest with you. And this is not just for you, but this is for everybody. Celebrities, people, know yourself, look at the menu and do the work. You get out what you put in. And I promise you, if you say no to that, you'll be saying yes to yourself. And that's not mission.
I literally had a conversation yesterday with Lunel about she changed her writer and put more fruit and vegetables in her writer. And she took the chicken wings out. Just yesterday, we talked about that.
You have to take that stuff, because if you do not, you're going to go down, and you're going to realize that enough chicken is going to clog your arteries. And we got to do better. We have to do better.
Dr. Commodore-Mensah, we're coming to a close in our conversation, but is there one, we talked about the Life Simple 7. Is there something else you wanted to mention as we close? And we're also going to have a fun time at the end of this, because I want you all to start thinking about your favorite songs for a playlist, because Chef Daniel Thomas and I have a former relationship regarding our song playlist.
Yes. So one last thing I would mention is that if you are diagnosed with hypertension or have high blood pressure, please invest in a home blood pressure machine. So depending on the kind of insurance you have, you may be able to get one for free or at a very discounted rate. But please invest in a blood pressure machine and check your blood pressure at home. It's really important that you know your numbers, right? You shouldn't go a year or two without having your blood pressure checked if you have hypertension. So that's all I'll leave you with. Get down with your blood pressure. The American Heart Association has this campaign that we'll talk about soon that is encouraging people to self-monitor their condition and take control of your condition. So thank you so much.
Cuff it. Yes.
So get it, flip it, cuff it, check it.
That's right.
And just to add to that real quick, doctor, I just want to let you know, because we don't talk about the type of medicines, because we have to understand that all medicines are not for all genes. In terms of, as Black people, if you're on blood pressure medicine, be careful of, in my personal opinion, that did not work for me as a Black man, lisinopril. You should just be careful of that one. There are other ones, some people it works for. Maybe think about losartan. There are other ones that you can look at, but be careful.
But it's really important, doctor, to have that conversation with your doctor.
With your doctor.
Yes.
With your doctor. Yes. I'm so glad you said that, Sybil. So people respond to medications differently.
Yes.
So if you're prescribed a medication and you have side effects, please have a conversation with your provider. They'll change your medication so that you can take one that has fewer side effects and actually get the benefit of the medicine. So you shouldn't discontinue the medicine completely because of side effects. So I'm so glad you mentioned that, Sybil. Have that conversation. Find a provider that you trust.
Yeah.
And develop that relationship and have those honest conversations and be real with them. If it's not working, don't fake it. If you're not taking your medicines because of side effects, don't fake it. Be honest with them so they can work with you to improve your condition.
The key part is find a doctor you trust, because a lot of Black people don't trust a lot of doctors, and that want to talk to brothers, that's their problem. So I'm glad you said that. Find a doctor you trust.
Okay, so trust me on this. My producer is yelling at me, screaming. We gotta wrap this up. But I did want to leave us on a note of some fun and activity. Chef Daniel Thomas and I were involved in a brackets contest, if you will, regarding our favorite songs, our playlist songs. Chef did not do as well as I did in the popularity.
First of all. Okay,
wait. So I want people to think about their songs. Show. If you have, when we come on the Chef Daniel show, we'll do it differently.
Oh, you go down. Yeah.
But I do want people to, and I don't know you guys who are on our team. If you have the time to show the list of our playlist, and as we're showing that, Guy, that is Chef Thomas's playlist there, and if you can see that, and
let me just tell you, I need 10 seconds. Producers, I hear you guys in my ear. Producers, I need to let you guys know that they said to me that you were supposed to create a playlist that was to get you moving for the heart rate. Right. That's what I was talking about. That's why I created my list. So everything you see on this playlist is getting a heart rate for the old school, new school, and all school. So praise them.
I think it's a great playlist. And as a matter of fact, I think we share some songs on this. So if you take a look at mine, mine is kind of amping up, and there was some moments of for the relaxation as well as for getting yourself amped up for exercise and things like that.
Don't get my heart rate up.
Oh, he does mine. Sorry. This wasn't about you, Chef. This was only about my heart. So Guy Torry, what do you think? You have some songs you'd like to add, or to
what? I'm gonna tell you right now. The album I've been listening to right now is just the whole album is fire. It's Snoop Dogg's Algorithms album. Okay. He has a bunch of features on there. Yeah. And every song is a banger.
It's
anything by Rihanna.
I understand that. Does your heart rate too? Yep.
The heart rate.
Dr. Commodore-Mensah, what do you think?
Oh, you've got to add some Afro beats to your playlist.
Okay.
Some Burna Boy or some, Wizkid, some Essence in your life.
There you go.
So that's what gets me moving. Afro beats, and
says the girl from Ghana. I'm not mad at you.
Yeah.
And Chef Daniel Thomas, I don't know that we have enough time, but how can people get a hold of your cauliflower recipe?
Oh, yes, I need that.
The Brussels sprout recipe.
Brussels sprouts.
You'll be able to find it on your website soon. Here you go.
Okay.
And I also sent it to American Heart Association. And it's just so simple. I mean, if you just want to just know it in 10 seconds, it's literally just oil, honey, onion, red pepper flakes, salt, pepper, and a little hot sauce. So just call it a day, mix it up together, put it on a pan, and you have yourself, Brussels sprouts. So you can do the same thing to cauliflower. Cauliflower is good with protein.
Right.
So I just wanted to show some love to that.
Oh, that's so awesome.
Next is jollof rice in honor of Dr. Mensah over there. See?
Yes.
I got you.
Thank you.
Okay. Guy, once again, as Dr. Commodore-Mensah mentioned, we want to give you our condolences for the loss of your friend, and we hope that you
diabetes.
Yeah. Absolutely. And so we want to remind everyone to reclaim your health and your heart health every day, every month, especially the month of April, as we acknowledge National Minority Health Month, but every day of our lives. We need to do something to get ourselves going and to do something good for ourselves, which means maintaining good health, right?
Yes.
Head to heart.org/HBP control to learn more about blood pressure, to empower yourself and your loved ones. Get that home monitoring for yourself. And Dr. Chef Daniel Thomas, how can people stay in touch with you?
You can look up at Chef DW Thomas, which is my Instagram, Twitter, and Facebook as Chef Daniel Thomas, or you can go to my website at chefdanielwthomas.com.
And Guy Torry, how can people keep up with you?
At Guy Torry on Twitter and on Instagram, and I'm figuring out my Facebook, but at Guy Torry, GUYTORRY. And make sure you watch Fat Tuesdays, the air hip hop comedy on Amazon Prime. You will laugh, you will cry.
I'm telling you,
have a great time. You'll be inspired.
And it's such a great piece of work. Congratulations. I'm so proud of you. So proud of you, my friend. And Dr. Yvonne Commodore-Mensah, how can people find you?
I'm also on Twitter, Y Commodore, and also on Instagram, Dr. Commodore RN. So I'm a nurse by training. So look forward to hearing from some of you.
Great. And thank you so much to all the folks at the American Heart Association. I want to thank our team as well. Arika Kason, you're the best. You're the heart and soul of this, and we appreciate you and all of your great team. And thank you all so much for joining us, and go out there, be healthy, be well. Thanks so much.
Take care, you guys.